A silent, buzzing threat is surging across the upper Midwest, turning pleasant summer evenings into a landscape of risk. Health officials in North Dakota and Minnesota are raising the alarm as cases of West Nile virus climb sharply, hitting a peak period for this mosquito-borne illness. But here's where it gets controversial. Despite clear annual warnings and known preventative measures, many people still underestimate the serious danger posed by a simple mosquito bite. As of Tuesday, August 26, the North Dakota Department of Health and Human Services has documented 43 human cases of West Nile virus. This number isn't just a statistic. It represents a significant jump, already exceeding last year's total of 38 cases, and blowing past the 5-year average of 32. To put this into a terrifying perspective, the state's historical peak was a devastating 369 cases in 2007, followed by another serious spike of 204 cases in 2018. This historical context shows how quickly a bad season can escalate. Minnesota is witnessing a similar troubling trend. The state's health department has reported 20 cases so far, and while that is still below the 35 cases recorded in all of 2024, the recent acceleration is cause for serious concern. And this is the part most people miss. The virus can be fatal. Minnesota has already reported 2 tragic deaths from West Nile virus this year. A stark reminder of its severity. Fortunately, North Dakota has not reported any fatalities at this time. Minnesota's worst year on record was also 2007, with 101 confirmed cases. Health experts in both states confirm that reports of the virus have intensified over recent weeks, with cases popping up not in one isolated area, but spread throughout both states. In North Dakota, Cass County is currently the epicenter, with 13 reported cases. Across the river in Minnesota, the risk is highest across 15 western counties, including Norman, Clay, and Wilkin. The threat became so immediate that the Moorhead City Council took decisive action, voting to resume aerial spraying to control the overwhelming mosquito population and the looming threat of disease. For beginners wondering how this all works, the process is both fascinating and frightening. Mosquitoes primarily acquire the virus when they feed on birds that are already infected. Then, when those same mosquitoes go looking for their next blood meal from a human or animal, they can transmit West Nile virus. It's crucial to understand that you cannot catch the virus directly from an infected person or animal. The mosquito is the essential carrier in this cycle. The U.S. Centers for Disease Control and Prevention, CDC, underscores that West Nile virus is not a minor ailment. It can lead to severe neurological illness and death. Nationally, the CDC estimates an average of 2,000 people fall ill from West Nile each year, with about 1,200 of those individuals developing serious, sometimes life-altering symptoms. Tragically, more than 120 Americans die from the virus annually. Perhaps the most alarming fact of all, there is no specific treatment or cure for West Nile virus in humans. Your body must fight it off on its own. This is a high-risk time of year for West Nile virus transmission, emphasized Elizabeth Schiffman, supervisor for the Minnesota Health Department's Vector-Borne Diseases Unit. It's important to prevent mosquito bites when people are enjoying time outside while the weather is still nice. That's the best way to avoid getting West Nile virus. While the CDC's national data was still being updated, it had already recorded 320 cases across 33 states as of August 19th, providing a snapshot of the widespread nature of the threat. This follows a total of 1,791 cases across the US in the previous year. So what can you do? Health officials strongly urge residents to take the following protective steps seriously. Use an insect repellent that is approved by the U.S. Environmental Protection Agency, EPA. When outdoors, wear long-sleeved shirts, long pants and other protective clothing. Be extra cautious during dusk and dawn, which are peak activity times for mosquitoes. Eliminate any sources of standing water around your property, like in buckets, planters and bird baths, where mosquitoes can lay their eggs. Ensure windows and doors have tight-fitting screens to keep mosquitoes outside, and keep your yard well trimmed. Now, we want to hear from you. With such a clear and present danger, do you think local governments are doing enough to control mosquito populations? Or should more aggressive measures like widespread aerial spraying be the norm? Is the personal responsibility to use repellent sufficient? Or are we underestimating a public health crisis that demands a stronger, coordinated response? Share your thoughts and experiences in the comments below.